Man, I don't get why I have to study chemistry. I'm going into medicine, not trying to become a scientist.
Hi, Adam. My name is Ariana. I couldn't help but overhear you, and well, I'd love to explain to you the importance of chemistry, but better yet, let me show you. Come with me. Welcome to the hospital. Chemistry is everywhere around us, especially in the hospital. I'm sure you read this in your textbook already, that chemistry provides a crucial understanding to the factors and processes that keep organisms alive. The composition of the human body itself can be explained by chemistry. Our bodies are made up of elements and cells. And just in the way that chemistry can explain our bodies, it can also help us to understand and treat diseases and illness. This is the pharmacy. Pharmacists use chemistry daily. It's necessary for them to understand the chemical makeup of medication and to understand how active ingredients interact. Don't believe me yet? This is the chemical structure of an antibiotic called amoxicillin. Just the other day, someone came in to fill a prescription for this and had failed to tell their doctor that they're taking another drug called allopurinol as well. Taking these two drugs together can cause rashes and fevers. Drug interactions are chemistry at work. We could probably take a look on the microscopic level and the symbolic information to understand what's going on at the macroscopic level in this case. The drugs' chemicals interacting are causing a negative effect to the body. This is the ER. A patient showed up late last night. She first saw the nurse, who took her vitals, started an IV, and assessed some bruises she had. The nurse noticed a high temperature. Body temperature needs to be regulated as it can affect chemical reactions within the body. She also made note of an abnormal respiratory rate. She knows that this can be caused by excess carbon dioxide in the body. Lastly, she administered fluids and measured the bruises in centimeters. The doctor reviewed the notes and went to see the patient. Because he understood the underlying chemistry giving rise to her symptoms, he ordered a blood gas test, which measures the amount of oxygen and carbon dioxide in the blood. As he expected, the results showed excess carbon dioxide. He diagnosed the patient with hypercapnia and began treatment. What we just looked at had to do with the macroscopic domain, a patient with visible symptoms being diagnosed and treated. But the underlying chemistry can be further emphasized by using a computational model of the respiratory system. This would fall under the symbolic domain. Our last stop, the lab. This is where blood tests and imaging are done. The drawing of blood itself has a chemical component. Blood draws are done to test for things such as carbon dioxide or oxygen, enzymes, and blood cells. As mentioned in Chemistry, Adams First, Second Edition, the ability of the blood to flow up a small tube against gravity is also a chemical action called capillary action. Imaging, such as ultrasounds and MRIs, also use chemistry to work. In ultrasounds, sound waves are passed through the body. The waves that come out of the body are then measured and calculations are performed. From those calculations, any abnormalities would be detected. And that's it. We start out with the metric system, and then once you're in medicine, that's all you'll use. Next up is the periodic table, and I guarantee a lot of those symbols you're struggling to remember right now will be readily stored in your long-term memory. You'll be checking patients and subconsciously understanding what your observations mean about their oxygen levels, carbon dioxide levels, and more. Moving on to more complex things, you'll begin to understand the elements and how they can be combined into drugs. You'll know what ailments they treat, when to prescribe, and what they should not be mixed with. And even more complex, you'll understand intricate chemical reactions, systems, and even the type of imaging a patient may need. Learning chemistry is like building the foundation of a building. Once you have finished the construction, the foundation isn't visible, but without it, it's bound to fall down. You won't be talking about chemistry every day, but it will be weaved into everything you do.